the definition of tendonitis is any inflammation that occurs in a tendon. And a tendon is something that attaches your muscle to your bone. So if you have any inflammation from overuse, that can be called tendonitis. So because there are so many different types of tendonitis, because we have tendons all over our body, it's really hard to specify a specific assessment. So I have a couple questions that you might want to ask yourself if you're wondering if you do have some kind of tendonitis. The first one is, are you having any pain during or after the sport or activity that you're constantly playing? Now we're not talking about one episode, we're talking about multiple episodes over time, whether it's a practice or in a game or anything like that. So be wary of that. The other one, going up and down stairs is a big one. So even in your own home, if you're having pain, especially in your kneecap area right below there, if you're noticing you're having pain going up or down stairs, that's definitely a warning sign that something might be going on. The other one is weakness in your grip. So for some of the tendonitis of the elbow, because the muscles cross the wrist there as well as the elbow, you may notice some issues with having to perform a grip with your hands, and you're like, well, I don't really grip all day long, or I don't throw anything. But if you think about it, if you're reaching for a glass in your cabinet and you need to grab that, or a gallon of milk out of the refrigerator, you will definitely realize with that dominant hand, if that's affected, that you're not being able to grip as well as you used to be able to grip. And you also want to know that there's also pain involved with that as well. The other thing is specific point tenderness, which I talked about earlier. So for the elbow would be right here at this outside spot. The other one would be the knee, underneath the kneecap. And then the last one would be on the back of the heel area, so where that thick tendon inserts into the heel bone. And then also another thing, if you're wondering about the Achilles tendonitis specifically, if you have pain rising up on your toes. When you rise up on your toes, you're using those muscles in your calf. And because your calf tends to get super tight when you have a problem like that, you'll go and rise up on your toes, and you'll notice that you have a lot of pain rising up on your toes. And not only that, you might actually not be able to rise up as well on one side versus the other because the pain is so bad and your calf is so tight. So these are things you really want to be wary of, whether it's you're a sports person and you're playing sports, or you just do something that you enjoy every single day. These can affect all different ages and varieties of people and activities. So if you ignore these symptoms, inflammation will just continue to go on and on and on, and things will definitely get worse, where you then might thin the tendon out so much that it actually tears, and then you will be unable to participate in the sport or do the things that you love, such as gardening or playing outside with your grandkids or anything like that. So it's something you don't want to let go, because if you catch it early, we can handle it early and you can get back to those activities a lot quicker. The other thing is that you might not be able to go back to work, because if you have a very heavy labor job and you need to use your arms and you can't use your arms, you're going to be out of work. So that's a big deal, and we don't want that to happen. You want to handle it right away. If you have any questions, you can call us and we can get you to come in and look at it and assess the situation. And remember, it's not always no pain, no gain. So that's really important to know, is that if you have pain, that means something is wrong, and that is a warning sign, and that is telling you that you need to get it checked out.